Welcome to the Nurse Perspective, where we delve into the vital intersection of healthcare, community, and public health nursing practices. In each episode, we'll explore a wide range of topics, from preventative care and health promotion to disease management and community engagement. We'll have special guests talking about specific topics near and dear to their hearts, and individuals with lived experiences shedding light on the challenges and successes of public health. Let's meet the team, starting with your host.
Hello, my name is Jacki Haley, RN, and I'm the Clinical Section Manager at Two Rivers Public Health Department, and I oversee nursing and all things clinical.
Hello, I'm Jordan Anderson, Public Health Nurse RN, and I am Team Lead on STIs and immunizations here at Two Rivers.
Hello, I am Liz Weems. I'm a Public Health Nurse RN, and I am the lead nurse here at Two Rivers Public Health Department.
Hello, I'm Melissa Kissinger, Public Health Nurse RN, and I do immunizations and disease surveillance here at Two Rivers.
Whether you're a seasoned public health nurse, a healthcare professional, a student aspiring to enter the field, or simply interested in learning more about the critical role of nursing in public health, this podcast is for you.
Welcome back, and thanks for tuning in. I'm Jacki Haley. Our guest speaker today is me. You guys have it. You are stuck with me. And I will be talking about cat scratch fever. So now on to the topic of the month. And that is cat scratch fever. Cat scratch fever. Yeah, we're going to be talking about cat scratch fever. Now, you might be thinking, is that even a real thing? And yes, it is. It is more than a catchy tune. And if you work in healthcare, you've probably come across a case or two, especially if you work in primary care or pediatric settings. So let's break down the basics of cat scratch fever, how it's diagnosed, treated, and of course, how we as nurses can support our patients through it. So people become infected with Bartonella henselae. Yeah, I'm not going to say that every time, guys. From the scratch of domestic or feral cats, particularly kittens, because, kittens and just like babies, they're infested with all sorts of diseases. But cats have fleas, and they carry that B. henselae bacteria. So these bacteria can be transmitted from a cat to a person during a scratch that is contaminated with flea feces. And infected cats that lick a person's open wound or bite can also spread that bacteria. There is some evidence, just a little, that suggests that these bacteria may spread directly to people by the bite of an infected cat flea, but it has not been proven. So the B. henselae infection, or the cat scratch disease, occurs most often in children under the age of 15. I mean, they're going to be having those kittens and kitties and everything, and, way more likely to just pick up a stray cat. Though it's more common in the Southeast, cat scratch disease occurs throughout the United States. And stray cats are more likely than pets to be infected with cat scratch fever. And in the United States, the most cases occur in the fall and the winter, because I'm pretty sure we all feel like they're cold and we need to pick up that stray little kitty. Anyway, so signs and symptoms. So if you have been infected, a person might feel or have a low-grade fever, enlarged tender lymph nodes that develop 1 to 3 weeks after the exposure to a cat, and then a papule or pustule at the site of the scratch. Sorry. Rarely you can get eye infections or infections of the eye, liver, spleen, brain, bones, or heart valves. And some of these infections occur primarily in people with weakened immune systems, such as those with advanced HIV infection. So, as with many Bartonella species, B. henselae can sometimes cause infection of the heart valves, called endocarditis, and in many cases, blood cultures might even be negative, which can make the diagnosis even more challenging. So the biggest thing is prevention. So how can we prevent people from getting cat scratch fever? We want to avoid cat scratches, bites, and licks, especially from kittens or stray cats. And this is especially important for people that have weakened immune systems. Also, when you are handling kittens or stray cats, wash your hands after handling promptly, and or wear, a glove that the cat couldn't bite through. Talk to your veterinarian about flea prevention products for your cat, especially if you have outdoor cats. And then keep cats indoors and away from stray cats. That will help. That way, you don't get fleas from a stray cat to your domesticated cat. And then people who have weakened immune systems should avoid owning cats less than 1 year old. So that could be hard, but if you are going to do that, there are lots of things to take into consideration. If they're going to be an indoor cat and you keep up with all their vaccinations and their heartworm and flea and tick and whatnot, you should be pretty good. All right, animal infection. So cats most commonly become infected with the B. henselae through the flea bites. They can less commonly become infected during fights with other infected cats or through feline blood transfusions. But those are two ways that it can be transmitted. While some cats could become ill, most simply have the bacteria in their blood without getting sick. And some studies have found that Bartonella bacteria in the blood of up to 1 in 3 healthy cats, particularly kittens. So it just goes to show you could have a cat or a stray cat that looks and acts completely normal, is not ill, but they could be carrying that bacteria. Testing and treatment is not recommended unless your pet is sick. And for cats that do become sick, the illness usually consists of a fever for 2 to 3 days. And symptoms requiring veterinarian care include fever lasting more than 3 days, vomiting, lethargy, red eyes, swollen lymph nodes, or decreased appetite. And treating pets for B. henselae with antibiotics can take a long time. So a way to reduce your risk of the cat getting cat scratch fever or infected with the B. henselae, keep your cat indoor. Keep cat scratches, bites, and licks. Avoid cat scratches, bites, and licks. And decline is not recommended to prevent cat scratch disease. Promptly wash any cat scratches or bites with soap and water. Avoid contact with fleas. So if you know that your animal has fleas, they need to be treated. And then there are preventative products that you can use that could be recommended by your veterinarian. If you are getting a cat, make sure it's at least a year old, in good health, and free of fleas. And avoid and do not adopt stray cats or cats with flea infestations. So I think the big takeaway on here is just if you are going to adopt a stray cat or a cat that has a flea infestation, see your veterinarian immediately. That way you can take the appropriate steps. That way nobody gets cat scratch fever. So to sum it up, cat scratch fever is a relatively common and usually mild illness, but it can cause some real problems in vulnerable populations. As nurses, we need to recognize the symptoms, educate our patients on prevention, and ensure proper treatment and follow-up care. Thanks for tuning in to this episode of The Nursing Perspective. If you've had any experience with cat scratch fever in your practice, we'd love to hear from you. On our next episode, we'll be talking with Elizabeth Weens, or Liz, and she is a public health nurse who will be educating everyone about West Nile virus, along with sharing important medical updates, both nationwide and right here at home.